Looks like we are live, and thank you everyone for joining us tonight. We have Arya back to share some amazing, wonderful information and good vibes. So I'll let Arya take it from here.
Hi, thank you so much for having me back. It's such a pleasure and an honor to come to these conversations and share some information that I hope people will find useful. So I'll start with a little introduction. I'm Arya Pretlow. I am a certified nurse midwife, and so that is a type of nurse practitioner, which is an advanced registered nurse practitioner here in Washington State. It means that I can provide primary care, I can provide prenatal, intrapartum, and postpartum care. Basically, I can take care of anyone who identifies as female from the time they enter adolescence through the end of life. And I refer for things that are like specialty things. So I work at Rainier Valley Birth and Health Center, and I don't do baby catching anymore. However, I take care of a lot of pregnant people. And because I'm also an international board certified lactation consultant, an IBCLC, I do a lot of breastfeeding medicine. And so today I'm here to talk in particular about breastfeeding. There is some really important new information that changes how we treat what we used to call plugged ducts and what we still call mastitis. And it is so vastly different from what all of us were taught, and any of us who breastfed probably did, that I'm like on a mission to spread this information so that, so that people can learn the tools that will actually help decrease their risk and increase their comfort while breastfeeding. You can find me at my website, or there's my work, my website work email address, or of course at Rainier Valley Birth and Health Center. And that website, I'm pointing to it like you can see. That website is where you can learn about us and our services, and also make an appointment if you want to. Slide, please. So I also identify as she, her, and so throughout this presentation, also it gets challenging sometimes when we talk about anything in healthcare. Now we're trying really hard to be inclusive, and I know that there are people who do not identify as mothers who are breastfeeding, and there are people with breasts who don't like to call it breastfeeding and they call it body feeding, and maybe someone who is a trans man who is chest feeding. There are so many ways to think of it and to do it. And if you have the body parts, and for ease of conversation, and because this is still what the protocol, the verbiage, the protocol uses, I'm still mostly going to talk about breastfeeding. But it's not because I'm assuming that only people who identify as women with breasts are doing it. Okay, so it helps to understand some about the normal expectations of lactating breasts, especially for people who've never done it before. So once you are about like second trimester, midway through second trimester, your body is already starting to produce that first milk, which is called colostrum, which is called liquid gold. Um, so, um, so some people will find that through the rest of pregnancy, maybe they leak, maybe they have just like sticky spots sometimes on their shirt, inside their bra. I woke up one morning and was like, why are my sheets stuck to me? And it's because during the night, I had just started leaking. I was like, hooray! Like it was.
Yeah.
So it is not a bad sign if you don't leak in pregnancy. That doesn't mean anything. And but it is a reassuring sign if you do. It's like, okay, cool. That's working so far. But don't worry if that never happened to you. That's also totally fine. Once the baby is born, then it's really the birth of the placenta, honestly, that tells your body that you are not pregnant anymore. As long as the placenta is attached, your body is still sort of like, I don't know, I feel like we still need to do stuff. And so once the placenta, this is the placenta, this is your uterus. Once the placenta follows the baby out, then there's this amazing change in the hormones, like right then and there, that prepare your body to basically now keep your baby alive on the outside. right? It's like, oh, right. We can't just, send nutrients through the blood into the placenta. We need to make milk, apparently. And so, so that process, if it's your first baby, can take 3 to 5 days. You have colostrum, your baby is not born hungry. Okay, so babies, normal, healthy pregnancies with term infants, they cry when they're born because everything is new and overwhelming, right? And that is how they are also like squawking to basically make sure that their parents are like, we hear you, we see you, we feel you, we got you, right? It's not because they're hungry. One of the many reasons they will cry is because they're hungry, but they got 99 reasons to cry, and that's only one of them. So it's always handy to be able to offer nursing to the baby because it's going to increase your supply, calm the baby, and feed the baby. That being said, it's born with some kind of extra calories, and the expectation of the newborn's body is that drops of colostrum, which is thick, very nutrient dense, it does not stream out of you. Your baby's only expecting that much. So even if they feed and you see like they just get drops, they that's enough, assuming they're healthy and they're transitioning to air breathing world, fine. So the change that's happening in the breast is actually the final stage of breast development. That's right. So think about in American, let's say in Western society, where it's like breasts are supposed to look a certain way, right? It's this youthful, perky, whatever. But also, most of those breasts haven't actually lactated before, which is the final stage of mature physiology. So part of that process is building all the infrastructure for that milk to be made and to get out and into the baby. So I like to tell people it's their first baby. So do all the snuggling, do all the skin to skin, offer the baby the breast every time they cue, which is by the time they're crying, they've been telling you for a while, right? Here's how baby tells you they're hungry. and like, right? And like, and also kind of like, like here's my baby. This is not real. I have to like, look, not a real baby. Okay. Right. When they're like kind of, a newborn will like bounce on you or like trying to suckle on your collarbone. You're like, that's a hungry baby. That's a hungry baby. Go ahead and feed them. If they were asleep and they just woke up, just assume they're hungry. Just assume they're hungry. That's probably what woke them up. What do babies dream about? Probably eating. I don't know. Probably. So, so if you offer without restriction and you're doing all the snuggling and things, that baby's stimulation of the breast is what tells your body, oh, this is for real. This baby's on the outside. This baby is apparently hungry. And we need to start shifting from this nutrient dense colostrum, which also has tons of antibodies and things and your microbiome to help your baby's guts be healthy and help their immune system be healthy. But at some point, it's going to need more volume. And colostrum is not a volume thing. You can't fill a bottle with colostrum. You might be able to fill like a tiny little syringe. That's what we send to like the NICU, right? So that process of shifting from colostrum to like you wake up one morning or maybe after even just a nap, like you go to sleep, maybe you're day 4 postpartum, you go to sleep, everything seems normal. You wake up and you're like, I what happened? Because they're huge. They're huge because now you have lactogenesis 2, which is the second stage of the making of milk, lactogenesis. And so you have now become a full-on milk maker. If you've had a baby before, it's probably going to happen closer to 3 days. If you super recently had a baby or you were still breastfeeding through pregnancy, it's, that's a whole other story. It's totally fine. You can tandem feed, just always feed the newborn first. But your factory is already like up and running. If it's been a couple years, your body just has to like flick on the lights and maybe dust a little bit. But if your last baby was like 10 years ago, 15 years ago, or you didn't breastfeed that baby, then your body is like having to remodel your factory. And so then it could take closer to 5 days. So first timers, totally normal to be 5 days, right? Anything shorter is luck of the draw, or you really did just like lie around and snuggle and feed on demand all the time. So once your milk is coming in, it's very normal for lactating breasts to feel sometimes lumpy, sometimes bumpy, sometimes full, sometimes uncomfortable, like tender. It's normal to hear literally any baby anywhere cry and leak milk. That's super annoying, but that's a real thing because your body it stimulates the hormones in your body to be like, oh, we could take care of that baby. Right? And you're like, okay, well, that's not always convenient. And then one of the things to expect in the early postpartum, there are so many hormone fluctuations and it can really make you feel a little bit feverish. Also, of course, you're like, there's a tendency to sweat off, cry off, and pee off all the extra fluid that you were retaining at the end of pregnancy. So sometimes that sweatiness can also make you wonder if you have a fever. But there's a normal hormone fluctuation that happens in postpartum. And the other thing to note is that if you go too long, and there is no specific definition for that because it depends on your supply and how frequently your baby feeds. But if, like, let's say your baby normally feeds anywhere from every 1 to 3 hours because they're a newborn, right? And for some reason they're like past 3 hours, I don't know, grandma was holding them and then they fell asleep, and now you're like, oh wow, my breasts hurt. Why? It's probably gotten to the longer end of what's a normal interval between feeds. And so that discomfort is also very normal. It can even be painful, and it can even cause redness and warmth in the breasts. And that's not infection, that's inflammation. Okay. Next slide, please. So that leads us to this lactogenesis 2, which is not the same as mastitis. Somewhere around days 3 to 5, when your milk has come in, there's a period of engorgement. And so the way that you know that this is engorgement and not mastitis is that both breasts are affected. If both breasts are affected, it is 99.999999999 times not going to be mastitis, because mastitis generally affects only one breast at a time. So the engorgement, both breasts are going to be full, like larger than usual, firm, warm to the touch, painful, and it can make it hard for the baby to latch. And so you want to do things that help decrease inflammation, decrease heat, and help move the milk a little bit to make it easier for the baby to latch. This is when the baby will kind of like, if this is the breast. So, here's what I usually do. Okay. So here's the nipple, and here's the breast. Let me see. Here's the breast. And so if your breast is usually like soft and nice, but now you're engorged, it essentially makes your nipple shorter, and all of this is hard. All the breast is hard. So your baby, not to scale, baby mouth is like, I'm just bouncing off this basketball and I cannot find the nipple. And so sometimes you need to hand express a little bit, which is a very important skill for anyone who's lactating to know. And I have a link later on to Stanford School of Medicine. Newborn Nursery has it's about a 7-minute video showing how to hand express. I recommend that for everyone. That can help release some of the milk, soften the breast so that the baby can latch well. And then you just proceed. Just feed. Okay. Things that can make your transition into like what you imagine for milk making, like maybe you hand express and it squirts across the room or something, are how you give birth can actually can cause a delay. So we know that cesarean birth can cause milk to come in later. Losing too much blood which cesarean almost always is. Even if they don't hemorrhage, there's surgery, so you lose more blood than you would assuming you don't hemorrhage with a vaginal delivery. So a hemorrhage can what's the word I want? Delay lactogenesis too. A really long, really long, drawn out, exhausting labor can delay it. And so the remedy is lots of quiet time, lots of snuggling, lots of rest, lots of food, and just have that baby on your body, because the baby's also tired. It was trying really hard that whole time to get born. Like, they work during birth. So everybody's tired. Give the parent a sandwich or whatever, something delicious that will just give them a little bit energy. Let everybody rest, but get that baby snuggled skin to skin. Okay, slide, please. So what if you actually are engorged and your baby is bouncing off of you? The things to do. This is helpful to know ahead of time. Anyone who's planning to breastfeed and is like, how do I prepare? One of the most important things is get your people on board. Like, is your partner on board? Is your whoever in your family that you are close to on board? If they need to come and talk to a lactation consultant and learn about how valuable it is and how to support you, awesome. We're happy to help. But one of the biggest indicators of a person's success at meeting their breastfeeding goal is the support not only of their partner, but of their mother and their mother-in-law, which gets really tricky. Then one of the questions that you submitted was like, what about cultural differences? And what about like just trying to breastfeed, like everybody trying to breastfeed in America, but also people of color. And there has been a trend for people either who have newly come to America to look around and kind of be like, I just see all these people bottle feeding and I want to try and fit in. And so I'm not going to be the weird person who whips out the boob. I'm going to also do that, right? There's that. There's generational trauma of enslaved Black women having to breastfeed their white masters' babies and not being able to feed their own babies. And so there's generational trauma of the implications for that, for Black women in particular. And there's also the challenge of just like socioeconomic issues. Like, if you're in school full time, if you're working 2 jobs and you just had a baby, breastfeeding takes time. Breastfeeding is not free. I'm going to say it again. You know, I like to say it. I'm going to say it again for the people in the back. Breastfeeding is not free. Breastfeeding costs the breastfeeding parent time and energy and sometimes comfort, right? And even if it's just social comfort, but also physical comfort. So we have to consider that this is work that has a purpose and a value for the parent, decreased risk of breast cancer, decreased, like all kinds of awesome things, and also the baby. But it needs the whole society to really consider the ways in which it benefits the whole society for babies to start out with the food that their bodies are expecting when they're born. And also, of course, it's not that easy, right? Some babies can't latch, some people can't make milk. There's all kinds of things. But if a person wants to breastfeed and what is standing in the way is family members who are like, that baby looks too hungry, right? Like, or that's gross. Why are you doing that? Or why are you doing it in public? Or why can't you go in the bathroom? Or like all the things that we hear, no matter where we come from, all of that makes it really hard. And so having psychosocial support is one of the most important things. And as much as possible, if a person can like get their support people identified and on board, even if it's just one person who is like, you can always call me and I'm going to be like, you got this, right? That's amazing. So if you are engorged, focus on relieving the symptoms. The symptoms are inflammation primarily and pain. So you can continue breastfeeding. You don't need to switch to pumping, assuming that the baby is able to latch. But how's that latch? Maybe some support from your midwife or a lactation consultant is in order, not because engorgement is in and of itself pathological, but because it can be very uncomfortable and sometimes you just need help. Also, if it's only 3 days postpartum, I mean, you know how you feel 3 days postpartum. You're like, it's just, how do I figure this out? Decrease stress, increase rest, and ice the breast. I know.
So,
Tell me.
and mastitis they have similar. Okay, what am I trying to say? So when I was breastfeeding and my breasts were like very solid and I was feeling kind of like ick because of it, I assumed I had mastitis. But you're saying the difference between the two is that with mastitis, one breast will be harder. And
Yep.
it would be both of your breasts would be.
Yeah.
Okay.
Yeah. Engorgement is the, like, for some reason your baby slept 6 hours instead of 4, and you woke up and thought that you would literally pop. Okay. Right? Both your breasts are so hard that you're like, oh, someone just remove them, please, because it's so, like, what is happening? And you're like waking up the baby. You're like, I'm like, whoever says let a sleeping baby sleep, I'm like, not if you need to feed that baby.
And to deal with inflammation, you're suggesting to ice. I've also heard running hot water over your breasts. Is that something too?
So if you find it soothing, that can help, but warmth will bring more blood flow. And because there is not infection, we don't necessarily need more blood flow and all the white blood cells. What we need is a little bit decreased to help remove the edema, the swelling. So this is why it can be cabbage leaves. Every culture has a different thing, right? It's like cabbage leaves, potato skins. It just depends on what you had, where you came from, and what your family stories are. A lot of people like to use cabbage. That's fine, but it's just as easy to just get an ice pack. It's maybe even easier. It's less messy. So you can ice at least every hour, not for a whole hour, but like 20 minutes, and then take a break. You can take ibuprofen, right? So Advil. That's if it's super inflamed. You can take also Tylenol for the pain, right? So ibuprofen helps some with pain, but that's really for the anti-inflammatory aspect. You can also take Tylenol. And lecithin, so soy lecithin or sunflower lecithin, can help reduce inflammation, but it has to be taken daily. And you take 5 to 10 milligrams per day. The amount of ibuprofen and Tylenol that is suggested is prescription strength. So I'm not going to say that because I don't want to put prescription stuff out there forever and ever in the internet. Great. Okay. Do that. Anything, like, what helps? So if a warm shower helps, right? Just like this. If a warm shower helps, that's fine, but don't. It used to be we would say, like, stand in the warm shower and massage and squeeze and try to. No, all of that makes the inflammation worse. It makes it worse. Yeah. Like, think about, what do you do when you sprain an ankle?
Elevate it, ice it.
Okay. I know. And also, okay. So I have this in the next slide. We could do slide. But a well-fitting supportive bra helps decrease your risk of inflammation, because think about it, if your breasts are bigger, they also are heavier, and so they're dangling, and anything, it's called dependent edema. Anything that is, the lower you go on the body, the more likely it is to get swollen, like those swollen ankles when you're pregnant or after a long day on your feet, right? I have seen, especially breasts that are larger and like heavier and low, they just, the bottoms will get so swollen. And it's because of dependent edema. It's because they're lower than the heart at that point, and they're so like you don't want to smush them because that can decrease your supply. Like, don't put on a sports bra, but a well-fitted supportive bra can help decrease that edema. Okay, so physiologic breastfeeding is what some people call feeding on demand, and I like to say feeding on cue because while I have parented a baby, she's 8 now, and I breastfed forever, and it feels very demanding. It seems mean to call it feeding on demand, so I say feeding on cue because they're cueing. They're just like, I would like some of that now, please. So physiologic breastfeeding does not focus on schedules, volume, or this concept of emptying your breast. So if you are pumping, treat it like you would physiologic breastfeeding. You're not trying to pump until literally nothing comes out. There's no benefit to that, and it increases your risk of injury and inflammation. If you are, if you have symptoms, okay, so here, if you're engorged, consider hand expressing to comfort. And I don't know if people will have access to this or if we can share the link somehow, but that's the link to, I was trying not to put pictures of actual breasts on this because I didn't know if you guys wanted this. So that is a link to a video that shows, not safe for work. It shows someone teaching someone how to hand express, and it's very useful. And can take the pressure off when you're engorged so that it softens the breast enough, lets your nipple stick back out again so your baby has something to hold on to. If the other thing to think about is you don't want to overstimulate. So if you're engorged, just like feed the baby, do what you need to do to soften the breast so the baby can feed, but we're not trying to also like pump it out or something, because that basically double stimulates, it double demands. So we talk about supply and demand with breastfeeding, but it's actually demand and supply. The demand happens first and your body responds with increased supply, right? So your baby enters a growth spurt and is like, all of a sudden, I cannot get enough. They're not starving. They are driven to tell your body that they're about to be bigger and are going to need more, right? So that demand, we have to be careful with pumping that we don't accidentally tell our body we have twins if we only have a singleton. And there is no benefit to oversupply. It is only increased risk of mastitis. Okay. The other, let's see. Yeah, okay. So the other thing that is recommended is if the baby cannot latch because the thing happened where it can't even get to the nipple, you can, especially if it happens to be just one side, you can rest that side, because what'll happen is if you don't feed on that side, it will decrease production until it is softened a little bit, and then that is a little bit of a decrease in supply, but your baby's going to fix that as soon as they can get back on. So that's a thing. But it frustrates everyone. And then like we walk into rooms and literally everyone in the room is crying. Like the mom's crying, the baby's crying, the partner's on the verge of tears because they don't know what to do. And we're like, okay, hold on. Like, let's all take a breath, because it gets very frustrating. And the baby can tell that something is amiss with their parent, and then they're like freaking out, right? And then the parent is like, why are you freaking out? I'm freaking out. Yeah, everybody's super sad. So we're trying to avoid the freakouts. Okay, slide please. So when do we go from engorgement to mastitis? One doesn't necessarily lead to the other. Engorgement is a physiologic stage of that process of moving from making colostrum, that liquid gold, to like squirty milk, right? And you get engorged if you go too long without feeding. Like sometimes it's just getting stuck in traffic. People are like, I keep a pump in my car in case I get stuck in traffic. I used to live in DC, and on the Beltway, you just never knew. Your commute could be 10 minutes or literally an hour and a half. And that could make all the difference between your comfort. So people keep pumps in their car and just be like, all right, well, I'm stuck here. They just go ahead and pump. So mastitis is what happens when inflammation in the milk duct, the connective tissue of the breast, and the blood vessels of the breast are all inflamed. And so milk ducts, I'm trying to look at all these. I got a pelvis, I got a baby, I don't have a breast model, but if you imagine the inside of the breast is full of little areas that make the milk, and it moves it into these tiny little microscopic tubes. And there's whole bunches of them. It's not like you just have a tube that goes to your nipple, right? And so there's actually multiple pores on the end of the nipple. And so, but there's even more than that duct work that goes in. So any of those areas could get inflamed. The number one cause of the inflammation is pumping more than you need to. If you do not need to pump, then don't. There's no benefit to pumping if you don't need it. If you're hoping to have a date night, you don't need to pump for 3 weeks leading up to the date night. You just need enough for the baby over the date night, right? Like, how long is your date going to be? That's how many feeds you need, right? So sometimes I find that people now, because of anxiety, COVID related anxiety, new parent related anxiety, just whatever reason anxiety, one of the things they want to do is like pump. They want to pump so they can be sure they always have some milk just in case something goes wrong. But the problem is the pumping can cause something to go wrong. So if you need to pump, of course, then you do, but try to make it as close to the physiologic breastfeeding routine as possible so that you're not, again, accidentally telling your body to make twice as much milk as it needs. The other thing to know is that nipple shields increase the risk in the same way that pumps do. So nipple shields are not evidence-based to improve literally anything. Now, we've all known someone who was like, the only way that baby latched was a nipple shield, but then they need more help because staying with a nipple shield eventually will decrease their supply, and it's not teaching the baby how to latch better. So as a short-term intervention, it can be a thing, but it is not the solution. It's just a Band-Aid, right? And more help is needed. And so then the other component is what's called mammary dysbiosis. So we have, just like in our guts, we talk about the, is it okay to pump and donate? Yeah, I mean, I think that the thing to consider is if you are pumping for the purpose of donating, or if you're like, why are you pumping? Do you need to pump? Did you need to pump and you had extra and so you donated it? Fabulous. Are you, just know that if you have a healthy, efficient nursling, right, and you also pump, you are risking, you have a higher risk of getting mastitis. That being said, it might be worth it to you if you're like, yeah, but I am pumping to feed my friend's baby, my sister's baby, some stranger's baby. It doesn't matter who the baby is, right? If you're like, no, this is something I can do and I feel strongly, then do it. Just be conscientious of like how to, like, don't drain the breasts all the way and don't do it so much extra. I hope that helps. Okay, so just like in our gut, we have a microbiome. We have a microbiome inside of our breasts. And so there are a couple of species of bacteria that live in there that are not dangerous to us. And they're just hanging out, doing their thing, which actually is kind of like, they kind of create sort of like Teflon in the ducts to help the milk flow more easily. But sometimes, whether it's because of genes or a person got sick, or they had to use antibiotics for something, or sometimes because they take probiotics and it's not the right kind for them, or regular breast pump use, or having a baby by cesarean, that just like that can mess up your gut flora, it can mess up your breast flora, and that can cause more of the mastitis problem of inflammation.
That makes a lot of sense.
Other risk factors for mastitis are perinatal mood and anxiety disorder. It's very important that people be assessed and supported not only in breastfeeding, but for mood disorder, because those two things are very closely linked as far as risk for breastfeeding problems. Okay, slide, please. So I'm looking at my laptop where I have my notes. Okay, outdated ideas about mastitis. Oh my goodness, these are the things. This is why I'm doing this, because this is all the stuff that I was taught and literally was telling people like up until 4 months ago. Milk stasis it's not a thing. Eating certain foods does not cause mastitis. Nipple trauma does not cause mastitis. Your nipples are very vascular. There's really great blood flow to the nipples, kind of like to your fingertips, right? You can get a paper cut and it's like, rah, 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 right? Why? Because we need our fingertips very much. And so we also need our nipples very much. They are very well, they have very good circulation. And that prevents infection of the nipple from going deeper into the body. It's not a thing. Yeast. If you get yeast on your nipple, it does not cause mastitis. This is going into the breast. There's no yeast mastitis. And this is the big thing. There's no such thing as a plugged duct. It's like the biggest facepalm in the world.
Yeah.
I mean, from 1 week to the next, I was telling someone like, use heat, use your toothbrush, your vibrating toothbrush, massage it. We got to break down the duct. And I read this new protocol from the Academy of Breastfeeding Medicine. I was like, so the next appointment, I'm like, the beauty of medicine is that we're always learning new things and we're all going to learn new things together. So here, I'm just going to tell you these things and we're going to talk about how you feel. We're not going to use heat. And we're not going to massage, and we are not going to use any vibrating devices on our breasts for the purpose of mastitis. Okay? No, yeah. Because all it does is cause more inflammation. I'm going to tell you what it is, though, that's not a plugged duct. So, ready? Next slide, please. So then what is it? It's narrowing of the duct. So ductal narrowing. Part of the problem is if you have an area of hardness and it feels like a little ball, right? And you think, okay, well, what's causing that? It must be plugged. What's it plugged with? I don't know. Maybe the fat of milk. Okay, that makes sense. Then we should heat it up to melt it.
That's literally like exactly what I thought too.
Of course, right? That's what we all thought. And then you should like massage real hard to try and break the dam, right? It was like, and then get that baby on, and then get that pump on because we're gonna pull it out, right? No, none of that. It turns out exactly the opposite is what happens. So the duct gets inflamed for any of the reasons I talked about in the previous slide. It gets inflamed, and so it becomes narrower. And so what happens anytime, like think about if you bonk your anywhere, but like I'm trying to think of something soft, like not your shin, but like have you ever bonked your arm on something and then you get like this, you get a goose egg. You're like, what is this knot in there? It's like that, right? That's just swelling and inflammation and increased blood flow. And it's just, that's all it is. It's that in your breast. And so you wouldn't massage a knot like that. It's not a muscle knot. We're not trying to break down some kind of tension right? So the firmness that we used to think of as a plug is actually a narrowing because of inflammation and an overgrowth of one of the species of your normal flora that has caused kind of a plug, but they are microscopic and you cannot feel them. So that's not it. Lymphatic congestion or swelling leads to, my little arrow means it leads to redness and tenderness. But if you don't have a fever, you don't feel like your heart is racing, you don't have muscle aches or chills, basically if you do not feel like you are coming down with the flu, it is just this early stage of ductal narrowing, which we used to call a plugged duct. So what do? You don't want to leave you like that. Physiologic breastfeeding and avoid increased stimulation. So we used to be like, feed the baby and then pump, or feed the baby that side, feed the baby the healthy side, and then feed the baby that side again. No, because that's telling you to keep making more milk, make more. And what it needs is to rest, to down regulate a little bit, which is a little bit decreased supply, so that that inflammation can go away. And then you just return to normal feeding and it's fine. You ice it, you take your ibuprofen or whatever for anti-inflammatories, and you rest, rest, rest. Almost always it happens when people are like, I did have a really busy weekend, or the toddler was sick, or my family came to visit, right? And the next day they're like so sick with unhappy breasts. So the previous advice, aggressively massage, heat it, squeeze, pump, increase the feedings, they not only do they not help, it's been frustrating for lactation consultants for years because this was the guidance, but in practice, what we saw was that it rarely actually helped people. It can make it worse and it can cause trauma to the breast. So the next slide has a picture of what that is. It's an image, if you will. So on the top, the healthy lactiferous duct. So you can see, if you imagine it kind of like a blood vessel, a teeny, like a capillary, teeny, tiny, 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 tiny little thing. And so you can see the colorful bacteria. It's like yellow and orange and blue. That's how they represented it. All kinds of different colors, different shapes. It's heterogeneous. It's a block party with people from all over the city, right? Came to this one block to hang out and have fun. And the milk flow is like, yay, awesome, this is easy. And so you can see it on the right side of the screen where it says duct cross section. If you were looking into that capillary, that's what it would look like. You would see like this kind of, the biofilm is a healthy biofilm and it just lets the milk flow. And there's not a lot of bacteria in there. Then the middle picture, mastitis with narrow duct. So we're at that stage where like it's becoming a plug. And so something has happened that a whole bunch of the variety of bacteria have left the neighborhood and only one kind is left. And that's not good for bacteria in any part of our body, not in our guts, not in our vagina, not in our breasts, not anywhere. We need multiple kinds, not in your mouth. We need multiple kinds of bacteria living in the places where we have bacteria, on your skin. So now it's all just pretty much one kind, which happens to be the black spheres. And so they start building up. So you can see where it's like they're trying to show you that this mammary epithelium has gotten swollen. Those little circles that look like eyeballs, that's to show you like, ooh, they're swelling. And then the black stuff is like this particular strain of your normal flora has overgrown and it's kicked out everybody else. And it's starting to make like in a cave, stalactites and stalagmites. I don't know which is which, but like it's all. And if you look at the cross section, look how much narrower. That's not good. So milk flow is already impacted. And then if you go to the bottom picture, it's already starting to show that milk is sort of backed up. And what you can't see, at least on my screen, my face is in the way, but there's an arrow pointing to a stick. Oh, thank you. That obstruction. That is not milk or milk fat. That is a blob of bacteria. And yet this still is not, does not need antibiotics. This is still just inflammation. Okay, so we go to the next slide and we are wrapping up. I'm trying to be, I get long-winded. Okay, so what if that ductal narrowing doesn't go away? What if what we used to think of as plug ducts doesn't go away? Then it develops into what's called inflammatory mastitis. And so you might have this area on your breast that is firm and hard and tender, and maybe you've noticed less milk flow and it's just, it's bothering you. And then you see, wait a minute, the redness has spread. And now I don't just have like a little marble, I have like a whole section of my breast that feels hard and is painful. And there's more swelling and it's just more of everything. This, you may or may not have a fever and aches and chills. Even if you do, it could all just be part of something called systemic inflammatory response syndrome. And it doesn't necessarily mean you have an infection. If you have systemic symptoms for over 24 hours and the breast is getting worse and not better, then antibiotics are in order. But if you have, like, almost always someone calls and they're like, something's happening, and then the next day they're like, okay, it's better. Like, this is why we don't give antibiotics right away, because most of the time you don't need it. If you do the things, the ice, the rest, the anti-inflammatories, the physiologic breastfeeding, and the studies upon which the Academy of Breastfeeding Medicine based this protocol, within 48 hours, the vast majority of inflammatory mastitis takes care of itself. Not really, because you've done all those things to take care of it, but like it doesn't need a healthcare provider to intervene. It needs family to come and clean your house and feed your family. Like, it needs people to come so that you can rest, and just feed your baby. Okay, slide, please. This is just all the words that I have just said for the past 40 minutes in a diagram. So it's hyperlactation. It's too much supply. Maybe also something going on with your microbiome in your breast leads to ductal narrowing, what we used to think of as a plug, which leads to inflammatory mastitis if it's untreated, which can become bacterial mastitis. We're not going into abscesses and phlegmons and all those things, because that's like, by that time you would have come to see me. So where does liquid gold come from? I don't know who started the term, honestly. I feel like probably it was some catchy phrase to help people understand how useful it is. There are cultures that think the baby should not eat it, and they have a tradition of feeding the baby other things until the milk has come in. The problem is, if you don't feed the baby the colostrum, you delay how long it takes for your milk to come in. And also the baby's body can't properly digest anything else yet. Not water, not juice, not dates. Please, no honey. That's dangerous. So I think that I have no idea, but I'm going to guess that somebody said it's like liquid gold. It's so valuable. Give it to your baby. Also, it's kind of gold. It's kind of yellow. And so I think that was it. People have all kinds of names for breastfeeding, and I feel like every breastfeeding, we call it a dyad, has something different. My daughter called it some people say nana, some people say, like, people have all kinds of milkies and num-nums. I think if you let your baby name it, you're going to come up with some wonderful family stories that you will laugh about forever. Okay, so the last little bit is like what you can do. There's 2 slides left. We have got this. What if you have inflammatory mastitis? A lot like if you get ductal narrowing, please rest. You don't have to overhydrate, but most people underhydrate. So hydrate enough that your urine is very pale yellow or clear. Eat well. You need more calories when you're breastfeeding than you did when you were pregnant, and keep breastfeeding. Take anti-inflammatories, use ice, and you can take Tylenol for pain. Wear a supportive, well-fitted bra. We talked about that. If it isn't improving after 48 hours, or you have systemic symptoms, fever, chills, aches for 24 hours, please see a breastfeeding knowledgeable healthcare provider. What I can't tell you is whether your provider is breastfeeding knowledgeable. I have been in places where they're like, oh, you have mastitis, we're going to give you this antibiotic and you need to pump and dump while you're on it. No, you don't. No. So irritating. So it really does. It's very helpful if you have a provider who is, whether it's the pediatrician, well, if it's you, it's probably going to have to be your provider, your midwife, your nurse midwife, your women's health nurse practitioner, a family nurse practitioner. Someone needs to assess and get you some help. We can also do therapeutic ultrasound. So if you've ever had physical therapy, they can use ultrasound not to look inside like we do to look at a baby in the womb, but to use the thermal energy to decrease inflammation. And I can do that. So there are providers who are trained to use therapeutic ultrasound on breasts to help reduce inflammation, and it can be very, very helpful. And we only use antibiotics for bacterial mastitis. And so that, yeah, if it's only been a day, it doesn't mean you need antibiotics. And there's no benefit. Antibiotics do not work to prevent bacterial mastitis. And antibiotic use can mess up your microbiome and make you more likely to get mastitis. So if you don't really need them, we don't want to give them to you. Not to mention, eventually antibiotics stop working, right? Everybody, all the little critters are becoming resistant. So we have to be really careful with antibiotic use. You can very, very gently, like the way you touch your baby's face, that kind of gentleness, massage your breasts for lymphatic drainage. But you should, under no circumstances, massage your breasts like like you're working out a kink in your neck. Okay, it's way too much, and it will cause problems. There's no evidence supporting changes to the breastfeeding positions unless it just makes breastfeeding more comfortable for the parent. Please do not dangle or things like that, like have the baby lying down and dangle over them. It can increase their chance of aspirating, which is when they breathe the milk into their lungs and not only choke, but like give them pneumonia. Like, no. And pumps don't move milk as well as a healthy term baby that's a good breastfeeder. So don't pump just because you have mastitis. You keep breastfeeding. The baby will not get sick from mastitis. And even if you end up with the kind that needs antibiotics, you can keep breastfeeding. It's safe for the baby. The last little thing is just one last bit, which is blebs. This is like a little, it's like an, if you know, you know. If you never had them, don't worry. If you've had them though, they're really annoying. So it's like a little hard, it's almost like a callus. It's like a callus on the tip of the nipple, and some of them are painful. And previously people would say, try and pick it off. Like people have used fingernails and like opened up paper clips to try, like, no, please, no. It's a sign of ductal inflammation. And so what you need to do is decrease inflammation. So if you have a bleb, now it can block the pore. And so that little area won't let milk past it. But don't pick it. It increases the chance of injury and therefore more inflammation, and then more narrowing, and then more mastitis. This is an instance where taking 5 to 10 milligrams of lecithin every day can help, because it can help decrease inflammation. And then if you were seeing me, I would also prescribe a relatively lowish dose of a topical steroid for short-term use, because that will decrease the inflammation and help. Phew! The last page is just references, so which is really just the protocol. I saw that question come up about colonization. I think it is so important. In my opinion, does colonization and Americanization have an effect on how parents of color go about breastfeeding and lactation? Yes. And not just my opinion, but the evidence. If you look into any kind of research that looks at breastfeeding trends amongst various populations, yes, there is clearly an impact on parents of color and when it comes to breastfeeding. And it goes both ways. Some are like, we are going to hold on to this because it's part of our cultural identity and we are going to breastfeed. And some are like, no, it marks us as other even more, and so we're not going to breastfeed. And then we have the people who are like, I would love to breastfeed, but how am I going to find time to do it? I have to go back to work in 2 weeks. And then we have people who are like, yeah, but I can't afford formula. And so I better breastfeed. But that process of like how, when someone comes to America, when they look around, what do they see? And is it what they want or try for any number of reasons to emulate, right? And if what they see is I'm gonna try to be diplomatic. I was gonna say a bunch of Karens. If what they see is a lot of people who don't look like them, who don't maybe talk like them, who don't have the same kind of culture as them, but for some reason seem to be what everyone else is aspiring to, and they're bottle feeding, then it is sort of like maybe they know something I don't know, or maybe like, why are they bottle feeding? I don't know. Is there something wrong with breastfeeding? Maybe this is what we do here. But among white people, just as everybody else, there was a period in the 70s and 80s where people just didn't breastfeed as much. Actually, it started earlier than that, 50s, 60s, 70s. It was like, why would you do that? We've invented this amazing thing called formula, and it's better. And so that whole generations of moms primarily didn't know how to breastfeed. And so then when their children came of age and had babies, they couldn't help them breastfeed. And so we lost generations of knowledge about breastfeeding. Like, why is there a profession to help breastfeeding? Because we've lost generational knowledge about it. Because it's not rocket science, you know. But if people don't know how to do it, then they're not super helpful at supporting other people to do it.
That's true. I thought you did a good job at addressing that too a little bit earlier when you said that immigrants, they come and they see the norm is bottle feeding, or how historically Black women had to feed their employers children rather than their own. There's that historical trauma. So I do appreciate that being said earlier. And very valid and very true points. So
it's really I think it's really important to consider the many reasons that impact a person's decision to breastfeed or not, and their ability to breastfeed or not. And that's happening more amongst white culture as well, of like, there are laws protecting your right to breastfeed in any public space, you know, and depending on what state you're in, also private spaces. Like, you can't get told to go to some nasty public bathroom in the restaurant. Like, there's nothing dirty about breastfeeding. You don't have to cover up. A lot of us are kind of like, I mean, I don't want to put a blanket on my baby's head just because they're eating. I just wear like a special top, you know. But yeah, breastfeeding, you know, if the baby needs to eat, a baby needs to eat. And once they're good at it, it's so convenient because you just always have their food ready. It's so easy. But it takes a little while to get that easy.
Oh my gosh.
You are so welcome. You're so welcome. It's my pleasure. So happy to help. If more questions come up, I'm happy to try to address them either on email or Facebook or whatever works. Did I get some of the questions, the burning questions? That I didn't see everything that got written across the screen, but
I feel like you did a really good job covering everything. Every time you said, do not like go in there and massage your breast, I was just having flashbacks to when I was breastfeeding, and I was like in the shower and I'm like, why isn't this working?
Right, totally.
So I think that's definitely helped somebody else.
Yes. So I always had a spot on my right breast. And every time I talk about plugged ducts, I point to the same spot on my breast. Every time I talk about anything uncomfortable. And you know what is so interesting is that I had never noticed anything at that spot before. But once I finally stopped breastfeeding, I was like, I have a little lump there. And so I went and got imaging, and they were like, it's just breast tissue. And I was like, but there's a lump. It's not even a cyst. It's not any. And they were like, no. They were like, it's so boring. I was like, well, good. But like, that was the spot. There's nothing wrong with that tissue. For some reason, I guess I just get inflammation there. And when I was breastfeeding, that was the spot. That was always my plugged duct that wasn't. Other fun facts about breastfeeding, something I find interesting that I love to share with others. one of my, it's not a fun fact exactly, but no matter what your personal history of trauma, breastfeeding for some people is very healing. And so I like to help people just consider trying it. There's a lot that can be challenging, the constant access to your body, the demand for your body. It can be very triggering if you have survived, intimate partner violence. There's a lot, but it can also heal so much inside of you. So I always like to share that. I think the other thing is, if you are feeding two babies at a time, like if you have a 2-year-old and a newborn, your body knows which one you're feeding. So you always feed the newborn first, but your body interacts with the saliva in your baby, and so every feeding is what that baby needs at that moment.
Love it.
What?
Oh my gosh.
Right? It's amazing.
I don't know why every time I hear that, it feels like a new epiphany for me.
Yeah.
But it's like I know it, but every time I hear it, it's like I just get that feeling like, oh my God, that's so cool.
So amazing. It's so amazing. Let's see. I did breastfeed. I breastfed for a really long time. I am a survivor of an abusive relationship a long, long time ago. And I very much wanted to breastfeed. And I honestly did not know if I would be able to do it. I didn't know if I would be able to tolerate that demand. But I really wanted to. And I pretty much knew I was only going to have this one baby. I had a lot of trouble getting pregnant and a lot of pregnancy losses. And so when I had this baby, I was like, ex-military. I was like, I'm going to suck it up. I'm going to do it and see what happens. And so thankfully, I took it day by day and then week by week. And I was like, yes, I know. I was already a trained midwife. I was like, yes, if I make it 6 months, that's amazing. And if I could do a year, that'd be great. And honestly, if I make it through this day, I will be happy. Right. And then the next day, and then the next day, I just set little goals for myself, and never was it actually triggering. For me, it was very, very healing. Like, I know that personally. It was so healing, so redemptive, and gave me a great opportunity as she got older, because we breastfed for over 4 years, to work on, of course, a 4-year-old doesn't breastfeed like a newborn, right? But like it still was like right before sleep, or to work on boundaries and autonomy, right? Like, she was never allowed to just come up and lift up my shirt. No, ma'am, right? She was not allowed to play with the other side. It made me crazy. So I taught her, like, you know how they'll mess with the other side?
Yes.
Like, oh my God, it's so awful. I taught her she was allowed to hold the other side, but not play with the nipple. And so she'd be like, and she would reach over and then go, and then look at me. And so sweet and gentle. And I would just say, like, that's my body, and you may not do that to me. And, yes, I would be happy to feed you, but not right now, because we have other things going on, and I will do it as soon as I'm ready. Like, not when she was a newborn, obviously, or like a nursling, but when she was older and toddling, was just sort of like, I see you, maybe I could have some booby. And we could have those conversations, which I felt like, for me, having a girl child, it was super important for her to learn that. Yes. From my modeling, that, like, you don't just get access, you don't get to do things to other people's bodies. Mm-hmm. Right? Like, we have this agreement, we have this relationship, it's very important. And also we both get to have some boundaries around it. So I think that, the small goals, the give it a go, it always starts out hard. It doesn't matter how much education and experience helping other people you have. Like, every baby is different. And so you just see how this baby does and give it a shot, and ask for help. By the time we made it to 6 months, I was like, well, now it's easy. So, okay. Like, she's interested in table food, but it's easy now, so I'll keep doing it. And then by the time it was a year, I was like, whatever, we'll just stop whenever.
You have such a not bubbly is not the right word, but
Not a lot.
joyful spirit to you, and for you to share that bit of information of like your real life and
Yeah.
how it felt for you to breastfeed is such an honor to hear.
Thank you. Thank you for saying that.
I really appreciate all the information that you came and you shared today. And I'm so thankful that we'll have this for anybody who will need to go back and replay and watch as many times as, oh my God, what did Arya say about plugged nuts that are not real?
Oh my God, I said it.
So it's so nice to have you back, and
thank you.
I look forward to every time we get to chat like this.
It's my pleasure. It's so fun. So thank you so much for listening, and thank you to the people who wrote in questions. I hope we got to them. If not, I'll go look on Facebook. It records them on Facebook, and I'll see what I can do to answer.
All right.
All right.
You have it here, folks. We have new updated information about plug ducks.
Not a thing.
Mass and breastfeeding, chest feeding, however you relate to in your lifestyle. Brought to you by our wonderful Arya.
Thank you.
Who works out of Rainier Valley. Oh my gosh, here I go again.
Name changes.
It'll be in the comments.
Rainier Valley Birth and Health Center.
There we go. Rainier Valley Birth and Health Center. Thank you, and we will see everyone again in the new year. Oh wait, it's November.
Do you have a December one?
December. Then the new year. Oh my gosh. Thank you, Arya.
My pleasure. Thank you.
And then later.
Okay. Bye.